Radiation oncology is a small field, and I would not have known about it if not for my mom's experience with cancer. She was diagnosed with head and neck cancer when I was just about to start medical school. She was treated with chemotherapy and radiation, and through that process, I learned about the field and got to know her radiation oncologist, who was really an exceptional physician and helped guide her through the course of treatment and made a huge difference in her outcome. When I was going through my clinical rotations towards the end of medical school, had a chance to rotate in radiation oncology and really enjoyed the personal experience that we have taking care of patients. Felt like I had an ability to empathize with the patients based on my mom's experience, and I felt like it was a great fit for me. My favorite thing about my job is the relationship that we develop with our patients. I'm seeing the patients at least once a week, oftentimes more often, and we really develop a close relationship and get to know each other. You know, we see each other, every few months after they're finished with their treatment, hopefully long into the survivorship phase. Just developing those relationships, seeing patients recover from their diagnosis and get back to normal life is really rewarding. Compass is really unique. There are not many practices like it, but I think what really appeals to me about Compass and what I enjoy about working at Compass is the fact that we have a team of doctors under one roof working to improve outcomes for the patients. I think the communication between the doctors, nurses, and staff is fantastic, and makes it really a great experience for the patients. I think that team-based care is really critical for patients just because communication is so important. Our treatment protocols are very complex and decision-making is complex. Having the input of all the specialists before making decisions regarding the best treatment for a patient is very important, and having everybody under one roof really facilitates that communication. Being able to walk upstairs and speak to my medical oncology colleagues or gynecologic oncology colleagues just down the hall really facilitates that collaborative care and allows us to make the best decisions for our patients. I think one of the things that's really appealing about Compass, both from a provider and patient perspective, is that we have access to a large portfolio of clinical trials through our affiliation with US Oncology. So that allows us to offer patients very exciting treatment options that they may not have elsewhere. We also have internal tumor boards or conferences where we discuss patient care, which allows us to talk about kind of the newest technologies that are available and the best treatment options with our colleagues. We're also part of larger citywide tumor boards and conferences here in Portland. So we're frequently participating in multidisciplinary discussions with our colleagues throughout the city. The best part about my job is teaching patients about what they're going through, teaching them about their diagnosis, helping them get informed, and helping them to feel more comfortable with what is going on. I think the diagnosis of cancer is obviously very frightening for most patients, and there's just so much uncertainty, so many questions that they often have when they step into our clinic for the first time. Being able to kind of give them a roadmap, help them understand what's going to happen, and help address those fears and concerns, I think is the most rewarding part of the process.